Hi everyone, welcome to today's webinar, Community Contact Tracing, a Method to Modernize and Enhance Contact Tracing with Location Data. This will introduce the concept of community contact tracing, the addition of location information to contact tracing to improve awareness of where viral spread may be occurring outside of direct and prolonged contact between two individuals. My name is Shannon Valzon and I will be your moderator today. We are joined by Dr. Esty Garrity, the Chief Medical Officer and Health Solutions Director at Esri. She leads a team of Health and Human Services subject matter experts who for the past few months have worked tirelessly with organizations like yours to support COVID-19 response. One of those team members is Jonathan Garrido-Lecca, a solutions engineer who will also be joining us and showcasing the ArcGIS capabilities for community contact tracing. And now I'd like to welcome Esty and Jonathan and turn it over to them.
Thanks, Shannon. Appreciate that. And hello, everyone. Welcome to this webinar focused on community contact tracing, which, as Shannon said, is an enhancement to traditional contact tracing approaches. So as she said, I'm Esty Garrity and I'm the Chief Medical Officer at Esri. I'm also a certified contact tracer. And my colleague, Jonathan Garrido-Lecca, has actually been working directly with a number of governments in community contact tracing activities and efforts. Community contact tracing is a term that we've coined to describe how location information complements the contact tracing process by accounting not only for identifiable contacts, people, but also for places in the community where cases have visited. This provides some huge benefits. By including location in our contact tracing workflows, we can uncover new insights about community transmission and see where new infections may be occurring. That allows us to focus our investigations and take targeted action in those places that are driving new infections. Before I start moving into the steps for community contact tracing, I did want to spend a few minutes clarifying what this approach is not. Community contact tracing is not about using GPS on your smartphones to track individual movements and then automatically notify people if they've been in close proximity to a case. Some governments have done this successfully, and it certainly can lead to quick identification of contacts and the use of fewer human resources to get that work done. But many countries may not find the idea of tracking acceptable even under these extraordinary conditions. Another concern is that GPS is actually not the best way to identify close contacts because there are so many opportunities to get false positive results. So imagine you have two people on opposite sides of a wall or a window, or two cars that are stopped next to each other waiting for a train to pass. These aren't really contacts, but they are in close proximity, and a GPS device wouldn't know the difference. This is also not about creating an app where residents sign in, contribute their location and test result information, and expect to be notified if their Bluetooth indicates they've been in close contact with a case. This approach not only suffers from the false positive problem, but it also requires broad participation to be successful. I am aware of some jurisdictions trying to implement this without much luck, seeing somewhere around a 2 to 4% population participation rate. The approach that we're going to talk about today is much simpler and a lot less invasive. So when we have collected those locations in our contact tracing efforts, we can take that information, even if it comes in a simple spreadsheet, and we can put it on a map, marking the very beginning step in our spatial analysis. The first analytic function that we might want to perform is a density analysis, which is visualized here on screen as a heat map, possibly providing some early clues about higher risk locations. Then moving on to link analysis, that gives us a better understanding of those person-to-person connections. Even better, when we pull in the location data in our link analysis, we can easily add measures of centrality, which comes from one of the components of graph theory, to determine the strength of person-to-place connections. Well, and then there are several ways to go even deeper with location to quickly provide additional evidence to either support or refute a particular place as being higher risk. Now, one way to dive deeper is to pull in social mobility data from the Living Atlas of the World. This mobility data is a free resource that can tell you the current levels of visitation for points of interest all across the country. So we need to monitor the process to get at those key metrics. Well, we've been looking to the organization Resolve to Save Lives, which is led by former CDC Director Dr. Tom Frieden, for some of the key indicators about the process, which they've really nicely outlined on their website. Those indicators can be kept up to date in a dynamic dashboard. And, having this level of visibility is going to help to identify and coach contact tracers that maybe aren't keeping up, or hiring new contact tracers if the workload is the problem, or identifying other bottlenecks in the system, which could be impacting the efficiency and therefore the effectiveness of the entire process.